Once again, good morning and welcome back. It's still Daybreak Africa, reaching you here from our studios in London City. Of course, I'm Ezekiel, Ogar. 24th of March was said to be the World Day for Tuberculosis. Now, there's plenty to actually talk about on that case, but we tend to, separate it and then talk in details, when it comes to tuberculosis, because it's one extensive topic we just can, tend to cover in just a day. And with us in the house is a nurse, a public health advocate, and also a very good speaker. I'm also an expert in this field, person of Omowumi, Fadairo. Welcome on Daybreak Africa, Omowumi.
Thank you so much.
It's so nice to have you join us.
Same here.
Yeah.
Now, let's talk about African struggle with tuberculosis. I know that when it comes to tuberculosis, there's lots of definition. Initially, I used to think maybe hard cough is practically tuberculosis, but tuberculosis, there's just so much more. Now, why not take us through, the term tuberculosis and how it tends to affect Africa? Because it's more like, people tend to actually argue the fact that it's more like predominantly an African disease per se.
Thank you very much for that question. But then, it's not an African disease. Yes, tuberculosis is a highly infectious disease that is caused by a particular organism, a bacteria. It is called Mycobacterium tuberculosis. I'll just take for instance when we had COVID-19. COVID-19 is an infection. I mean the virus, right? So it was not limited to Nigerian, or it was because it's an infectious organism, and then it can spread through the air, so it could go anywhere. It could be transmitted far and wide. So let me just clear that. So it's actually a subject of public health concern because of the way it spreads and the fact that it has far-reaching effect. It's not just about cough, about the lungs, about the chest. It could actually spread as far as the brain and different organs of the body, and that's why we have pulmonary tuberculosis. That's when it's limited to just the lungs, like it's focused on the lungs. Then we could also have others, the extra pulmonary tuberculosis. So I just wanted to say that's why it's a very important topic that we should discuss, right?
Why does it tend to rather be predominant in Africa then?
Well, I would say from my home point of view that Africans are people that they might not really take certain things seriously. For example, I just want to bring this thing close home. So during the COVID-19 era, some persons find using nose mask too much. They will tell you it's a lie, it's not. But I feel like it's unfair. It's just like what we call cough etiquette. Like, you're coughing, why should you cough in the public? You could just go to the restroom and then cough, wash your nose, or if you're in the public, cough into your elbow or something, or use at least social responsibility. But I see that many Africans are, they just focus on maybe what the majority can say, it's a lie, COVID-19 is not. So everybody it makes us more vulnerable. Right, and because it's not just about that immediate, somebody just coughs now. Somebody has coughed 5-10 minutes ago, the particles has gone into the hair, it has settled on surfaces. People will open door, they will not wash hand when they get home, they will prick their nose and all of that. These are the little things that people do not they do not pay attention to, that makes it worse. And the fact that even when that okay, I might not have been 100% perfect. Of course, sometimes I go to a particular, hey, I need to wash can I get soap? They say there's no soap, right? And I can only get water. But when I get home, I should wash my hand. But if I realize that, okay, I'm not able to even do all of these things, once in a while, why don't I go to the hospital and check myself? But some persons, even if they are dying, they'll tell you it is spiritual, or they'll tell you that it's a lie, it is one cause. They won't take responsibilities. That's what I feel personally, that Africans, they do not take responsibility for their health, and they do not take precautions. So it's when things are very late, almost too late, that they begin to shake. In fact, I work in the hospital and it's over 7 years, so I know I can describe Africans, Nigerians very well. So when they come initially and you're still trying to explain, they don't even have patience to listen to that explanation. To them, you are wasting their time. Ma, you have to do, I'm sorry I'm taking time, right?
Please.
If you say, ma, you need to go and run a test, when you run the test, come back with this, and then when you're done, take it to the, it's too much. That explanation. If you don't get, it will explain to you 10 times. But to see, they are never patient. They feel like, see, I don't have time. Let's see, some of them they can just walk out of the hospital. They want to do too many things at the same time. Let me just enter the hospital, and then they are looking for someone they know that will just do one shortcut for them. I don't support that, because you will not be able to take adequate documentation. When you come back the next time, you're, oh, I was here last week. Did you go to the right means? They say, I have one. They just did. We are the ones that will suffer it in the end, because the day you will come back and you need that help. Sometimes when my patients comes into the hospital, and you know, they come inside with this smile of confidence, like, you know me now, that time that I came, it still happened yesterday. And I don't know, I'm a storyteller, so I might just keep going on.
Okay.
You know, so it's just the hallmark is, we Africans, Nigerians, we need to learn how to take responsibility for our health and take precautions, because even children of 2 years, 6 months, you can teach them how to take responsibility, and they grow up with it that, oh, I should wash my hand in the morning when I come inside. They will even start singing with it, and they will be happy to do it, because that's how it works.
Yes.
So
now talking about tuberculosis, a lot of people don't actually know the fact that there are different types. Like you rightly told us about pulmonary lung tuberculosis. I know that aside the tuberculosis that infects the lungs, we also have tuberculosis that infects other organs in the body, organs like the spine, the brain, and of course the kidneys,
abdomen,
which is systemic biliary tuberculosis. Could you please expatiate more by educating our viewer that aside tuberculosis that infects, which is the lungs, which is pulmonary lungs tuberculosis, there are other organs in the body that tuberculosis could actually infect?
Yeah, infect. Okay, it's just simple. The same way that, you know, our body is wired to work together. Our body is built to work in synergy. So when a part of the body is affected, it only takes a while to affect other organs of the body. So let me just make it very simple. So the way this infection works is, when it infects a particular organ, it causes a lot of tissue degeneration, you know, sometimes enlargement, and with time those cells, you know, those affected cells, they get dislodged from those parts, and they can be carried through the bloodstream to the different organs of the body. So they can go to the spine, and then somebody says, I was coughing 6 months ago, so did you treat it? No, but now the person is complaining of back pain, is not able to walk well. It could be as a result of that untreated tuberculosis. So now it could be in the abdomen, because it could spread to any organ of the body. It could, because all of these organs are actually connected one way or the other via the blood system, via the venous system, the nerves and tissues. You know, that's where the body is actually connected. So it keeps spreading like that till it gets to the brain. The same way cancer, you know, they'll say somebody had cancer of the breast, and then there's metastasis. It has spread to organs, because it will multiply, to proliferate, and then it will take other species and spread. So that's just the basic principle around that. So it's really nothing public they need to be worried about, because when it gets there, it manifests the way, if anything happens to your back, it will affect the way you walk. So if anything happens to your abdomen, it will affect maybe the way you're eating pattern, you're having pains. If it affects your kidney, your urination, you know, you be maybe frequent urination, and all the other symptoms that, you know, associate with those organs will start manifesting. So it's just the principle of something affecting other organs of the body over time. Yeah.
Now, before we talk about causes, during my research, I was shocked to discover that there are 3 stages of tuberculosis, which is the primary stage, the latent or dormant stage, and of course the active stage of tuberculosis. It was a huge eye-opener for me, because initially I actually thought it was just pulmonary lung tuberculosis. Before I discovered there was systemic malarial tuberculosis. So could you break it down before we begin to go into causes, symptoms, treatment, or situations that may predispose to tuberculosis? Okay. Could you break these 3 stages for us? The primary, the latent, and of course the active stages before we go into causes.
All right. What I want the public to know is I like to say the same way, so they would not be carried away with my explanation. So when there's an acute phase of an infection, that primary just mentioned, you see a lot of symptoms. You're coughing frequently. At some point, maybe the symptoms will be very pronounced, right? That's primary stage of it. It's very pronounced. Everybody, why are you coughing? Why are you coughing? You're sweating, deny. Like, it's primary. If it's not treated over time, the body gets, because the body will also mobilize the immune system to tackle that problem. So with time, it's as if the body gains some control over it, then it becomes latent. You think it has gone. No, that's when it's latent. Latent means hidden, so it's hiding somewhere. In fact, that's the time it's penetrating other organs, gaining ground, right? So the other parts where it now takes over, takes over other organs. The person can no longer breathe well. The person is like is having, maybe it has affected the brain, is having some loss of orientation, is feeling dizzy. But I was coughing 6 months ago. It was just cough, like Nigerians and Africans may do sometimes. It was just cough, this cough, we use this, we use that. Did you come to the hospital? No. So it would, that's what plays out almost all the time, right? Because the body also has a way of we call it compensatory mechanism of the body. It has a way, since you're not taking the right action, the body itself will want to like help out. So while doing that, the body's immune system will break down in the middle of it, and causing all of these things to now gain ground, because now you're not taking the right action. You're overloading your system. What was not there before, you become vulnerable to it. And again, they will not still be careful with. We still expose ourselves. People will still drink. They will still engage in high risk behaviors that will predispose them to more of these things. So just basic, that's how I feel people should relate to
the 3 stages of tuberculosis.
Yeah.
So I'm wondering, how common is tuberculosis? Because again, I am not the expert. You are the expert. In the course of my research, I discovered that about 10 million people worldwide get infected with tuberculosis yearly. That is a huge margin. But coming back home to Nigeria, how common is tuberculosis infection in Nigeria? Could you give us a peek into Africa and of course globally?
I love that question. Do you know, I was saying something before now that, over there in all the developed countries, there's a way they capture people report in the hospital, so there is data and you can almost be sure that it's accurate. But I can tell you for sure that it's common in Nigeria. We see it in the hospital, but most people do not present in the hospital because they see every cough as normal, right? Next thing, they get cough syrup, they start using. Next thing, there's one mixture, herbal mixture they want to use. They won't come to the hospital so that we can capture all of these things, document and ensure that we are actually doing the right thing. So most of the time we rely on previous researches, some anecdotal evidence here and there, right? Because people do not actually present until other organs are affected and all the rest. But what I want to say for sure is, from my years of practice, tuberculosis is common, and even in Ondo State, there are infectious. Like there are ways we handle those kind of infectious diseases. So you see private wards in the hospital where if anybody has tuberculosis, that's where they are meant to be. But sometimes there can be misdiagnosis because they are not presenting with those classical signs, right? So it's now affecting somewhere else. So they put them with medical cases. Person is not able to work. They are going to another unit. I'm just trying to open our eyes to the problems that Africans we have. So, but I think that settles that question a bit.
It is very common. That
right?
is
It's
really
very
scary.
common. Yeah, it's very common.
Now, what's your take on dieting, nutrition in correlation with tuberculosis? Because basically, an average Nigerian only cares about the meal, not exactly how balanced that diet is.
Yeah.
Usually, considering our present economy currently.
tell
So,
you.
what's the relationship between good dieting, good nutrition, and tuberculosis?
Tuberculosis. I want to say to the general public that you cannot do wrong when you eat well. There was this trendy joke sometimes ago that before anything, my brother, eat well.
Eat first.
Eat first. Thank you, ma. And I find that very valid. Even personally, I think I began to take more caution. I've always loved. I'm not big sized, so people always think that this one cannot like food, But then I had to tell myself it's not about trying to look like small. I'm like naturally small, but then I had to like tell myself what I need. So it's about what the body needs. There are 3 classes that everybody should be aware, so that when you're eating, you're not just eating blindly. You must eat bodybuilding, energy giving, and body protective. So it's not just to get energy. Let me just eat and be full. You need to eat bodybuilding too. It's not just bodybuilding like physical, like your organs. They're being built, right? And then the body protective, what protects your immune system, that guards you against infection. Sometimes, maybe I should use this example. During the COVID-19 pandemic, I work in the hospital, so it was compulsory. Everybody had to be screened. That time was a very emotional time for us as nurses. So we were in my ward. We were all tested, and I tested positive actually. Yeah. So because I have this responsibility for myself and then for my environment, they said we should stay at home. So throughout I think was it 7 days or so, I didn't go out, and I had people. I called a friend of mine. Please, I've been diagnosed of COVID-19. She's also a nurse. So I told her, buy this, buy fruits, buy all kinds of ginger, garlic. So buy everything for me and bring it to because I'm going on house arrest. Let me just put it that way. So I had everything at home with me, and then I had some multivitamins. Like as at that time, there was one particular one I was using, and then I wasn't going anywhere. So the only business I had was to eat well, wake up,
care for your health,
and care for myself, because I've always cared for people. I would wake up, eat my food, do some exercise, listen to song. I was just taking care of myself and nothing more. So after about I think it was time to go back to work, they called us and some said no, it was not negative. No, it was not positive, it's negative. So I think we went for a retest and they said we're negative, that we should come back to work. But I think I didn't take any drug per se.
So you went natural.
I was just eating
right
well,
foods,
resting well,
vitamins,
protein, rich food. So bodybuilding, you have to eat protein, vitamins, body protective, those micronutrients, right? You have to eat all of those. But energy giving food too is important, because if you don't have physical strength, you can't be talking about, so energy giving food too are very important.
So for one actually suffering from TB, is there certain meal expected to stay away from, or probably
stay away
adopt?
Yeah. That's what I'm just trying to say. If you want to stay healthy, whether you're sick or you're trying to prevent, eat this food in the right proportion. So for someone who is managing tuberculosis, that means the person, the immune system is low, is depressed because of the infection, and the person is also maybe on antibiotics and all of that. The person needs to eat more of body protective that will boost the immune system, like protein, vitamins, micronutrients, food that have zinc, that has all of these those little the ones that they eat in smaller quantity, iron, all those micronutrients, they have to be present.
Okay.
Yeah.
Now you've told us that you made us realize more or less that tuberculosis is a common infection in society. As scary as that may sound, I think it's time for us to find out the causes. We've been told that we can get infected by droplets, someone coughing, it could be airborne and stuff like that. I really want you to let us know, because we live with our family, we go to work every day, we get on the bus every day, we have relationship with our loved ones, as it were, as adults. We have husbands, we have wives who are in close proximity. We walk, we go to the markets. We go to the market, we interact with people. We see people cough all the time. Are you saying everyone is in danger? How do you contact tuberculosis?
Actually, I will start by saying that tuberculosis is highly infectious, right? Meaning that it can be easily spread, especially amongst people who stay together, just like you've mentioned. During COVID-19 pandemic, if anyone is infected with COVID-19, trust me, the whole family had to be on that treatment. They had to take precaution. If not, you understand, and they can spread it. I'm just using that because it's a recent common example for people to relate to. So I'm saying that for tuberculosis now, it's just about the droplet, right? When someone that is infected, if there's no infection, there's no how, because that's the causative agent. So other factors might make it possible. Like there are other factors that will make you vulnerable, right, to heat, because it's possible there are droplets and the next person is not contracting it because the person is taking precaution, there's a distance, or the person gets home, washes his hand and all of that. So but it's basically an airborne infection through droplets, and when it drops on, it settles on surfaces, people can pick them up like that and take it. When it's they get infected, they could also spread it to other people. So that's what makes it highly infectious. So I think that's just basically the causes, and that the causative organism is bacterium tuberculosis. So it's a bacterial infection, then it has to be treated in that line. So I think I've answered that question.
Like the fact that one can actually spread tuberculosis through coughing, singing. I was shocked to find out that you could actually get infected through singing.
Release more droplets when you're singing. You release more when you're chatting, when you're talking with people. You release some droplets. Kissing, there's exchange. So it's going to be unwise for you to know that you are infected, or for you to know that your partner is infected, and then even though we're living in close proximity, we should be able to give some distance, ensure that they are taking care of themselves while you are also boosting your own immunity so that you don't get infected. So that's how it works for any kind of infectious disease.
Now for TB, I understood the treatment could actually extend for say 6 months or even more. I think there comes a problem. How would you actually encourage a patient to actually continue in that treatment for 6 months and probably 9 months?
Yes.
The case maybe, and I heard it's not exactly curable. It could only be contained.
It's actually treatable and curable.
Okay.
It's curable. What I want the public to know is science is I don't know. Science is a lot. It's not just about what we knew yesterday, last year. Science is advancing. That's why we are having research here and there. So it's actually treatable because it's infectious. So the particular infection. The particular drugs, set of drugs that should be used. But I want to quickly say this. The reason why it becomes almost difficult to cure for us in this part of the world is because we present late, right? We do not show up in the hospital in time, or we say it's cough, then we start treating with all kinds.
I think the reason to that is because the symptoms tend not to actually show forth, not until an extended period of time.
No, it will show. If you're coughing and it's persistent, you're coughing for 1 week, that should raise a concern. Then as you're coughing, you realize that you feel tired, you're losing, you might not even see that weight loss in time, but you get tired easily. You're gasping for air, you are not able to eat well, then all of a sudden as you're coughing you're seeing blood. That's part of seeing blood might take a while before you see
so
that.
now you're giving us the symptoms, right?
Yeah.
Because that was the next question I was about to ask before we talk about treatment per se.
Right.
Now could you tell us, you told us the causes. We have an idea of how it can be contracted. Now could you give us the symptoms, because you made us realize that not all cough is ordinary cough.
Yes.
I am guilty of that fact, and a lot of us are guilty.
Yeah.
99% of us are guilty of the fact that every cough is a simple cough. We hardly go to the hospital for any checkup, and unfortunately when we treat the cough it goes. But now we've discovered now that there is a primary period, there is a latent period, and now there is an active period, so one has to be cautious. Could you give us some of the symptoms beside coughing that could predispose to tuberculosis?
That could point us in that direction.
Yes, in that direction.
Exactly. I love the fact that when people come to the hospital, they are not going to meet just one person that just decides you have tuberculosis. It has to go through stages. Doctors would brainstorm with themselves. When they bring the diagnosis out, the nurses look into it as well. We're going to manage the patient, and then we are noticing some things. We call their attention to, this is more than, but we point the attention to what we observe, because sometimes patients don't know what they should raise concern about. That's why staying at home and treating yourself sometimes is not the best. In fact, sometimes when a patient walks in, even from that walking in, we're already telling, the way, ma, are you okay? You are sweating. Ma, you are tired. They say, you know that there's something wrong. So I'm just saying that because it's not a kind of cough that you treat at home. So when you're in the hospital, from time to time, we begin to see that, this is more than, even if it wasn't showing at first. Right, some persons were in the hospital for a while before they got screened for tuberculosis. They had to even do chest x-ray to find out that this is actually a case of tuberculosis, and we need to take it very seriously so that we don't even put all of us at risk.
So the symptoms: chills, fever, night sweat.
Yeah, night sweat, weight loss. I think there are three cardinal signs that can always point us to tuberculosis. One of it is that weight loss, that persistent cough, and the night sweat. If anyone is sweating in the night profusely and then is coughing blood and is losing weight, those three, it's tuberculosis based on research and what we have always seen. So other things now depends on the stage, how far it has gone, right? Maybe the back pain, the abdominal pain. That's what even would tell us what kind of tests we need to carry out to know where are we now in the old stage. To get there.
I was actually listening to some professionals speak, and he made mention of the fact that one can actually have tuberculosis and yet, say for a period of 6 months or 7 months and have no symptoms to actually show forth. But you tend to disagree with that fact.
You were saying that some persons claim that in 6 months they might not know or show, and
yes,
it's not true.
More like the symptoms are not really forthcoming as you.
It's not true. What I would not say is not true absolutely, but then I feel like should I just tell you, I work in the hospital. People are never sincere to tell you, because there's what we call telltale sign. There's a problem. See, the way we are sitting down now, we're comfortable because there's no obstruction in your airway. You're breathing without you knowing. We're not supposed to be aware and conscious that we're breathing, but the moment that you're breathing and then you feel like you have to put some effort, there's a problem. But we're not aware. Some people are not. Some people will be dying. They will be like, you as a nurse, you can see how they are showing that vulnerability, maybe in trying to guard, like somebody is doing like this, somebody is like, you're going through something, but you're trying to be strong. No, people know when they are down. You can feel you're breathing, like everybody's smiling. For you to smile is because you are comfortable, But by the time you begin to have some I don't like the way I'm breathing. I just want to climb. I want to go and take something in the kitchen. I feel tired. There's a problem. Were you feeling that way yesterday? So you say you want to rest. The next day is still there. You eat well, it's still there. You should rest concern and go to the hospital. So
if we move a little bit forward to diagnosis and of course test, if we already know that we have pulmonary lung tuberculosis and we discover that we have systemic malarial tuberculosis, how do you go about a diagnosis before you eventually get to testing? How do you differentiate between pulmonary lung tuberculosis and systemic malarial tuberculosis? How do you go about diagnosis? And of course, I discovered from research that there are 2 tests that can be taken: the Mantoux tuberculin skin test, and of course the interferon gamma release assay test. Before you get to the test, how do you go about deciding what a person or a patient is actually suffering from, the type, as it were?
All right. Even though I'm not a medical doctor, I'm a nurse, but it's clear. When you come to the hospital, we take medical history. That's the first thing. That's why I said sometimes people are not sincere, because you don't expect me to know what you are going through if you don't tell me. Even though we'll still get to testing. But first of all, help us by telling us everything. Like I said, asking questions from people is too much. I hear people, including my mother, sometimes I say, Mommy, you tell them everything. Don't say, that question was much. You stay there. If it's 2 hours, stay there. Let them ask all the questions and tell them everything. If you have made a mistake, it's fine. Tell them I used one. So medical history, all the medical history is very, very important. So as a nurse, we also do our own. Check your vital signs, check the physical assessment. All of those things will begin to point us to, why is this respiratory rate this high? Why is it this low? Why is the pulse rate this high? All of those things are pointer. If the temperature, someone that is just coming in, we have not even done anything, your temperature is already high, there's a problem. That's pointing us to an infection. So everybody in the hospital there begins to take their own part. So the laboratory scientists also would be invited. They should take their sample, and before you know it, will come up with a robust diagnosis. Of course, there are differentials too. We have to also do some tests, not just to even tell us whether it's tuberculosis, to exclude some other close, like some other diagnosis. So coming to the hospital is a journey of patience. When you come, you have to be patient, so that we carry out all of this procedure, so that we can be able to point out what exactly is wrong.
Is wrong.
Yeah.
So who should be tested? Because I found out that a lot of us don't take our health seriously. We don't go for checkups. Fine, we discovered again, I have to happen this, that we have 3 stages, like Ezekiel is trying to tell you, to try to explain to you, because information that we get is that it's important for it to be latent. It depends on the body. Some people will break out immediately, some will carry this disease for a very long time. Then for those who carry it in their body and
they are not aware,
and people who work in close proximity with people like someone like you, who is a medical personnel, who work in a hospital or health space, apart from someone like you, who else should avail themselves for constant testing to find out they have tuberculosis? Which category of people are more predisposed to get in contact, to get infected, that should worry, and that are watching right now should actually avail themselves for testing, before we talk about treatment and of course resistant tuberculosis, as it were?
Yeah, I think I get the better picture of what you're trying to say now. Because an individual could be in that latent stage because they couldn't pick it when it was primary, so it's now there for a long time and they do not know. So they thought that cough was normal cough and it has gone. So now it's latent. Yeah, there are other signs, right? Okay, before I talk about persons that are predisposed to that, right? If you have abdominal pain and you cannot relate that cause to anything, like it's not like you ate food that was spoiled, your stomach is paining you, it's consistent, you're not able to breathe well, you don't find it easy to breathe well, no matter how you explain it, you just find that you're not finding it easy to breathe well, difficulty in breathing, you should raise concern, you should come to the hospital. If you're not able to walk well, you're not old, you're just in your maybe like 30, 40, you're not old to start having spinal issues, except it has to do with your work, the kind of work you're doing. You're doing well with your work, you're protecting your back, but then all of a sudden there's this back pain. You should come to the hospital. It could be tuberculosis. And then for kidney now, you are having, that's why I love the fact that we're having this conversation, because some persons, they have back pain. What comes to their head is maybe rheumatism, maybe arthritis. So let me get maybe a product in the market and rub it. You might not be sure. You should go to the hospital. So maybe it's now affecting the kidney. You're not able to, like, you're having some pains, your lower abdomen, your back, because the kidney is at the posterior part. Yeah, so you're having that back pain, right, on your flank. It's not always about I worked too hard, that's why I'm feeling that pain. You should actually go to the hospital if that pain is persistent, right? And then I don't expect that anybody will start having brain involvement and will still be at home. I don't expect that, but then it happens, man. It happens. So now, let me now say, people, if everything I've just mentioned now, if you have any of these things, you should raise concern. Apart from that, I'm coughing 3 days, 1 week, it's still there, raise concern. But then the cough has gone, but now you are not having abdominal, it was cough before, now it's abdominal pain, this place is swelling, or next thing, as I was going, I was just tired. In the night, you are now sweating, you know. Sorry, I'm sounding like I'm acting drama, you know. And in the night, you're not able to sleep well in the night. Like, you take this position, except you sit down, that's when you feel better. When you're lying down, you feel like somebody is coming to take your breath away. You're not comfortable. You should raise concern. But generally, if you're working in, you know, working with people in a room, maybe this place is not congested now, so it might be a bit difficult. If you're there's see the distance now, but there's some places where in the market you always, like, you're working, everybody's rubbing on each other. It's very easy. Somebody will even cough unconsciously, you know, and they say, she didn't know. But then it's the way. So social distancing is something that we should always still practice, even though there's no COVID-19 pandemic. So marketplaces, people that are also smoking, sorry, I have to bring this in, some of our high risk behaviors before predispose us to all of these things. It has broken down our system down, so we won't even know which one is happening, because we have this one, that one concussion here, one. So people should generally seek healthcare if there is any concern, no matter how little. But when you are working in places, maybe in the hospital, then you are not having all of these symptoms. Yeah, so I think I've done justice to that.
What about vaccine? Do we have a vaccine for this? How common is this vaccine? Is it free? And probably what's the year range?
Yeah, I'm actually trying to remember the name of the vaccine now for children, right? So vaccination is very important, right? And for children, there are like, it's not just Nigeria, everywhere globally there are immunization schedule from 0 to 6 months, even till 1 year, that a child must take. So if a child is born and misses that opportunity, there are some children that we call zero dose children, that in the areas where they are, there's even nothing like immunization, because they were not captured. It's either they were born in maybe places where, maybe not in the hospital, they were born places where they don't believe that they need vaccination, or they believe that they are covered, right? They don't need that. That child is more predisposed, is more vulnerable to contracting tuberculosis in the future. So it's available for children, right? And every child that is born in the hospital would have a card, and all of these things are monitored. There's a particular one, I'm just slipped off my mind right now. So they take it, and if you take it, it makes you less vulnerable. I mean, it provides that protection. So it's not really common amongst children because they most of them have taken, for those that took that vaccination. But adults, over time, we injure our immune system now, make ourselves vulnerable again and again and again. So there are vaccines for children. For adults, I'm not quite sure that we have for now, but for children, it's available.
If you're just joining us, this is Daybreak Africa, where we're taking a look at tuberculosis causes to cure. And our guest is still here with us. She is Omowumi Fadairo, a public health advocate as well as a registered nurse. Now, I want to ask before we go any further, what about cases of resistance to tuberculosis? Because Ezekiel asked a question that he heard that tuberculosis has no cure, which you countered that it has a cure. Again, in my course of research, I discovered that there are people who become resistant probably to the drugs that are given, to the vaccines that they take. What happens to people with resistant tuberculosis? How do you handle that, and what advice do you have for them?
Well, it's actually something that I've seen personally. I've seen someone that had a resistant tuberculosis before, but these things would have grade.
Okay.
Yeah, it would have grade. So for every of these stages, there are management, there are principles that sometimes it's just palliative care if it's very bad, right? But if it is treatable, if it involves surgical operation, right, and the patient can afford it, they will do that. Yeah, but when you said the word resistant, it means that the antibiotics, the combination therapy is not working. If that's what you mean, that means it has passed the level of there's an infection. It has actually become systemic and affected more than one organs. So it's difficult for the doctor to probably so they have to do more of palliative care, maintenance care, right? In that, and if the patient is patient enough, over time, it requires a lot of patience. Some of them could come out of it because other professionals had to come in, right? Physiotherapists, everybody had to come in to ensure that this patient the health is able to get restored. Might not be fully, but at least. So it's still part of what we do in the hospital. We cannot write anybody off, even if it's resistant. There are care advanced, like there's no end except there's death. So yeah, so I won't be able to say everything there because of our time. Yeah, I hope I answered that question.
Yes, I think you did.
Yeah.
It same goes with complication that comes with and side effects that comes with resistant tuberculosis.
Yes. And I think, sorry to cut in, I feel like some of the issue is because we have used a lot of antibiotics. So we were not sure of what it was. So we have used a lot of antibiotics, and it has moved away. It has progressed from something that antibiotics can now do. So that's where we now say it's resistant, right? But in the hospital, there are a lot of tests they do to be able to confirm, even if it's no more pulmonary, even if it's now on the skin. There are, up until having a CT scan, MRI, if they have to do it and the patient can afford it, they will do it. They will do it.
All right, thank you very much for checking us in.
You're welcome.
We obviously out of time. I mean,
Yes,
there's already
we
given
could
us
just
a
go on and on to talk about this
hopefully have a
topic.
second episode.
Yes. So if you're just joining us, you've missed out discussion on tuberculosis today with our guest, but you can always catch up by watching on YouTube this particular episode, so you can get all the information that you want. Before we go, let me just say the symptoms: bad cough, pain in the chest, coughing blood, fatigue, loss of appetite, weight loss, chills, fever, night sweats are some of the symptoms. So make sure that you take care of your health. Our guest has been Omowumi Fadairo, who is a public health advocate as well as a registered nurse. We appreciate you for coming
very much,
on the show. Yes, my name is Anire Binitie.
Have a wonderful day. Stay healthy. I remain Ezekiel Ogar.